There are moments in medicine when experience, technology, and decades of study still fall short of providing answers. Pregnancy, one of the most studied and monitored processes in human life, can still unfold in ways that leave doctors speechless and families suspended between fear and disbelief. Imagine preparing for a routine delivery, surrounded by professionals who have done this thousands of times, only to find yourself in a situation that no textbook fully explains. Imagine a newborn declared missing, panic spreading through sterile hallways, only for the truth to surface in the most unexpected way. These are not myths or legends, these are real situations that challenge doctors and families, reminding us that even in modern hospitals, life can still write its own mysterious script. Pregnancy is often described as predictable in its stages, measurable in its development, and manageable with modern medical tools. Ultrasounds map growth, monitors track heartbeats, and specialists anticipate complications long before they arise. Yet, hidden within this carefully structured system are rare and unexplained cases that defy expectation. Today we explore the mysteries of pregnancy, moments when medicine is also surprised, when science confronts the limits of certainty, and when reality feels stranger than fiction. From unusual physiological phenomena to hospital events that unfolded in ways no one anticipated, this story reveals how fragile and astonishing life can be. If you are fascinated by true stories that blur the line between science and mystery, make sure to like this video, subscribe to the channel, and stay with us until the end. Pregnancy is one of the most monitored medical conditions in the modern world, surrounded by technology that promises clarity and reassurance at every stage. Ultrasound images reveal the first flickers of life. Blood tests measure hormonal shifts with mathematical precision, and digital monitors record each heartbeat as if translating biology into predictable data. Yet, despite all these tools, there remain rare and unexplained cases that challenge even the most seasoned professionals. Doctors, trained to anticipate patterns and probabilities, sometimes encounter situations that resist categorization. These cases do not simply complicate medical charts, they disrupt expectations and stir a quiet humility within hospital walls. When medicine is also surprised, it reveals an essential truth: life is not entirely programmable. There are pregnancies that evolve outside statistical comfort zones, conditions that mimic other diagnoses, and moments when a healthy process suddenly shifts into something baffling. In these instances, families are not just patients but witnesses to something profoundly uncertain, navigating fear and hope simultaneously. Among the rarest occurrences are cryptic pregnancies, situations in which a woman remains unaware of her pregnancy until very late or even until labor begins. Despite physical changes that might seem obvious to outsiders, some bodies adapt in subtle ways, concealing symptoms beneath irregular cycles, minimal weight gain, or misinterpreted discomfort. For physicians, these cases are perplexing because standard diagnostic methods typically reveal pregnancy early. Hormonal levels may fluctuate atypically, or early symptoms may resemble common conditions such as stress or digestive disturbances. Families often struggle to understand how something so life-altering could remain hidden for months. Yet, documented cases demonstrate that biology does not always conform to expectation. When a woman arrives at an emergency department with abdominal pain and leaves holding a newborn, the experience shakes both medical staff and relatives. It becomes a reminder that certainty in medicine is often provisional, and that even the most carefully designed systems cannot fully anticipate the complexities of human physiology. Another phenomenon that continues to puzzle specialists is the occurrence of vanishing twin syndrome, in which one twin disappears early in pregnancy, often absorbed into the mother's body or the surviving twin. Ultrasound technology may initially detect two heartbeats, only for one to fade without clear explanation. For families who celebrated the anticipation of twins, the emotional shift can be overwhelming. For doctors, it presents a clinical mystery that blends biology and uncertainty. While science offers theories about chromosomal abnormalities or early developmental complications, the precise mechanisms remain partially understood. In some cases, no trace of the vanished twin remains visible, leaving behind only questions and an echo of what might have been. These experiences highlight how pregnancy, though measurable, contains layers of unpredictability that defy neat conclusions. Medicine can describe probabilities, but it cannot always narrate the full story of why certain developments unfold the way they do, or why one life continues while another silently fades. There are also cases in which fetal positioning challenges every expectation, with babies adopting unusual orientations that complicate delivery and defy standard explanations. While breech positions are well documented, rare instances occur where imaging appears to show one configuration, yet delivery reveals another entirely. Advanced imaging technologies are highly reliable, yet not infallible. When surgeons prepare for a specific presentation and encounter something different, tension fills the operating room. It is not a failure of competence but a confrontation with biological variability. Such moments demand rapid adaptation and calm precision. Families, often unaware of the technical complexities behind the scenes, sense only the shift in atmosphere, the urgency that replaces routine. These cases remind professionals that each pregnancy is unique, even when statistics suggest predictability. No two bodies respond identically to hormonal surges, uterine expansion, or fetal movement. In the quiet after a successful delivery, doctors may exchange glances that acknowledge the mystery they have just navigated. Equally surprising are rare cases of superfetation, in which a woman conceives a second time while already pregnant. Though extraordinarily uncommon in humans, documented instances have shown embryos of different gestational ages developing simultaneously. This phenomenon challenges the conventional understanding that ovulation ceases during pregnancy. In the few cases reported, medical teams must calculate development timelines with extraordinary care, as the fetuses may require different monitoring strategies. Families confronted with such news often experience a blend of disbelief and wonder. The idea that the body could initiate a second conception while sustaining an existing pregnancy seems almost paradoxical. For medicine, superfetation raises questions about hormonal regulation and reproductive timing that are still being studied. It demonstrates that biological systems, though governed by intricate mechanisms, can occasionally bypass what are assumed to be fixed boundaries. When confronted with such anomalies, specialists are reminded that human reproduction, despite centuries of study, still contains chapters not fully written. Perhaps even more emotionally charged are situations involving unexplained fetal movements that temporarily cease, prompting urgent interventions. In many cases, decreased movement signals distress and requires immediate action. Yet there are rare instances where monitoring suggests absence of activity, only for movement to resume spontaneously without medical explanation. These episodes create waves of anxiety that ripple through families and clinical teams alike. Hours may pass in tense observation, machines quietly humming, as everyone waits for signs of life. When the heartbeat reasserts itself clearly and rhythmically, relief feels almost miraculous. For physicians, such recoveries invite cautious gratitude but also scientific curiosity. What mechanisms allow for such sudden recoveries? Was there a transient compression, a subtle physiological shift too fleeting to capture? The answers are often speculative. These experiences reinforce the fragile threshold between alarm and reassurance, reminding all involved that pregnancy unfolds within a dynamic environment where change can occur rapidly and without warning. Infections during pregnancy also sometimes present in ways that confound expectations, producing symptoms that mimic benign conditions before escalating unpredictably. While protocols exist to identify and manage complications swiftly, there are documented cases where standard tests initially return normal results, only for complications to emerge hours later. Medicine thrives on early detection, yet these rare progressions underscore that not every condition follows a textbook timeline. Families may feel blindsided by rapid developments, struggling to reconcile earlier reassurance with sudden urgency. Doctors, trained to rely on evidence-based guidelines, must pivot quickly when evidence evolves in real time. Such cases do not diminish the power of medicine but rather highlight its constant dialogue with uncertainty. Every hospital corridor has witnessed moments when calm shifts into coordinated intensity, when teams mobilized not out of panic but out of respect for how swiftly circumstances can change. These episodes deepen professional humility and remind families that vigilance remains essential. One of the most perplexing mysteries arises when imaging and physical examination appear contradictory. In rare circumstances, scans may suggest complications that do not manifest during delivery, or conversely, appear normal despite hidden challenges. Technological interpretation depends on angles, clarity, and human analysis, all of which carry small margins of error. When discrepancies emerge, they test trust in equipment and expertise alike. Yet such moments also illustrate the collaborative nature of medicine, as specialists consult colleagues, repeat tests, and reassess assumptions. Families observing these reassessments may sense uncertainty, but they are also witnessing diligence. The willingness to question initial conclusions is not weakness but strength. It is through this rigorous reevaluation that safety is maintained. These rare inconsistencies, though unsettling, reaffirm that medicine is not static but adaptive, evolving with each case encountered. Even the most advanced systems cannot eliminate ambiguity entirely, and within that ambiguity lies the space where mystery resides. There are stories of premature labor halted unexpectedly without clear intervention, as if the body recalibrates itself. Contractions may intensify dramatically, signaling imminent birth, only to subside without medication or identifiable cause. For mothers preparing emotionally for delivery, such reversals can feel disorienting. For clinicians, they prompt careful observation and documentation. What internal processes shift so rapidly? Was it a transient stress response, a hormonal fluctuation, or something subtler still? These cases, though rare, highlight the extraordinary regulatory capacities of the human body. Pregnancy is not merely a passive state but an active orchestration of signals and responses. When that orchestration shifts unpredictably, it reveals complexity beyond easy measurement. Families navigating these experiences often oscillate between relief and confusion, grateful for extended gestation, yet uncertain about what triggered the change. Medicine may offer hypotheses, but the full symphony of biological interactions often remains partially concealed. And then there are hospital moments that transcend physiology and enter the realm of profound human shock. In one such rare and unexplained case, a newborn was delivered under urgent circumstances and briefly taken for routine evaluation. Documentation was completed, identification protocols initiated, and the environment seemed controlled. Yet within minutes, confusion spread. The baby was reported lost. Panic rippled through corridors designed for order. Nurses retraced steps, security systems were reviewed, and families confronted unimaginable fear. In those intense minutes, medicine itself seemed suspended between procedure and disbelief. Every protocol was scrutinized, every door monitored, time stretched unnaturally. The possibility that a newborn could vanish within a hospital challenged assumptions of safety and precision. It was a moment when certainty fractured, and professionals who prided themselves on control faced something inexplicable. As the search intensified, staff revisited every room, every incubator, every storage space, convinced that logic would soon prevail. Surveillance footage was examined, timestamps cross-checked, and patient logs reviewed with meticulous attention. Families clung to hope while bracing for the unthinkable. The atmosphere in the maternity ward shifted from routine celebration to collective anxiety. Yet beneath the mounting tension lay a quiet determination to uncover the truth. No one accepted the idea that a life could simply disappear. Minutes felt like hours as layers of verification unfolded. Then, in a development as astonishing as the initial report, the baby was found in the hospital minutes before being reported lost, safe but mistakenly documented under an incomplete identification process. The discovery triggered overwhelming relief, yet also a sobering reflection on how quickly misunderstanding can escalate into crisis. The twist did not end the questions. How could identification protocols falter in an environment designed for precision? Investigations revealed a convergence of minor oversights, none catastrophic alone, yet collectively capable of creating chaos. A misread wristband, a hurried data entry, and simultaneous shift changes formed a perfect storm of confusion. Medicine prides itself on redundancy and safety nets, Yet even robust systems rely on human execution. This incident became a case study in humility, prompting revisions in protocol and renewed emphasis on communication. For the family, the emotional imprint lingered far longer than the administrative review. Those minutes of uncertainty etched themselves into memory, a stark reminder of vulnerability within places meant to safeguard life. The hospital, though vindicated by the baby's safe recovery, carried forward a renewed respect for how fragile order can be. Stories like this reverberate beyond individual hospitals, reminding professionals worldwide that rare and unexplained cases demand vigilance and compassion. When medicine is also surprised, it is not a failure but a confrontation with complexity. The human body and the systems built to support it operate within layers of interdependence. A small deviation can cascade into confusion if not swiftly recognized. Yet these experiences also showcase resilience. Teams unite under pressure, families draw strength from uncertainty, and procedures evolve in response to lessons learned. Each rare event becomes part of collective knowledge, strengthening future safeguards. The mysteries of pregnancy are not merely medical curiosities, they are lived realities that shape both policy and perspective. Ultimately, pregnancy stands at the intersection of biology and mystery, science and wonder. Despite imaging technologies, genetic testing, and predictive analytics, there remains an element that defies total control. Rare and unexplained cases will continue to emerge, not as indictments of medicine but as reminders of its limits. Situations that challenge doctors and families reveal the profound responsibility carried within maternity wards. They also reveal the extraordinary resilience of those who navigate uncertainty. When a baby was only found in the hospital minutes before being reported lost, it underscored how swiftly fear can arise and how powerfully relief can restore hope. In these moments, the practice of medicine becomes more than technical expertise. It becomes a testament to humility, vigilance, and the enduring mystery of life itself. Pregnancy is often framed as a journey guided by science, supported by data and safeguarded by protocol. Yet the rare and unexplained cases remind us that life resists complete containment. When medicine is also surprised, it is not evidence of weakness but proof that humanity still stands in awe of its own complexity. The mysteries of pregnancy teach humility to professionals and resilience to families. They reveal that certainty is precious but never absolute, and sometimes, in the tension between fear and relief, we rediscover something profound, that life, even in sterile hospital corridors, carries a spark of unpredictability that commands both respect and wonder.